Hello everyone, my name is Gabriella McElroy. I am a junior, a double major in psychology and gerontology, and a minor in general business. And today I'm going to be talking about abuse in children with special needs. I'm going to start today by addressing the problem at hand. Children with disabilities experience higher rates of abuse and neglect when compared to children without disabilities. This is an alarming statistic because this group of individuals is already a marginalized population. The rates of abuse have continued to increase since the COVID-19 pandemic, and it is important to recognize the signs of abuse as well as to be an advocate for children with special needs undergoing abuse. I want to be a pediatric occupational therapist, and I am going to be working with a large population of special needs children. I not only want to raise awareness on this issue, but I want everyone to learn how to be an advocate and not just the professionals who will work with this population. I will first define what a child with disability is. So, this is a child with intellectual disabilities, emotional disturbances including autism, visual or hearing impairments, learning disabilities, physical disabilities, behavioral problems, or any other medical condition which affects functioning development or requires special medical care. And this definition was found in an article written by Nowak in 2015. And now for some additional statistics regarding this problem. So Sullivan and Kungston found children with disabilities are more likely to suffer multiple forms of maltreatment, endure repeated rather than single episodes of abuse, and face abuse earlier in life. In an article written by Jones and colleagues, they concluded that children with disabilities are at 3 to 4 times the risk of inflicted violence than non-disabled peers. And lastly, amongst children with disabilities, children with less obvious disabilities have actually been found to be at a higher risk of abuse by caregivers than those with more obvious signs of disabilities. And this was found in an article written by Benedict and colleagues. Child abuse at a young age can be very detrimental for brain development. Abuse can also interfere with attachment and the child's ability to form healthy relationships with their peers and adults. As shown by the statistics mentioned prior, children with special needs are more likely to be abused earlier in life, which is extremely problematic. The impact of abuse differs with each person, but there has been a lot of research conducted about the negative effects that abuse can have on an individual's physical and mental health, not only at the time of the abuse, but all the way into adulthood as well. It is important to find solutions to help recognize abuse and put a stop to the abuse that occurs in children with special needs. They already have many barriers they have to overcome in their lives, and having a higher susceptibility to suffer from abuse shouldn't be one of them. Now I'm going to discuss some solutions that can help solve this problem. The 3 solutions I'm going to discuss are the active detection of abuse, careful support of disclosures of abuse, and maintaining trusted relationships with children with disabilities. This is especially important for any individual who will work with children. And I say all children because sometimes you may not be aware that a child is special needs because they may not present obvious signs. Active detection of abuse means being educated on what the signs of abuse are. Not everyone is provided with in-depth training on the signs of abuse, let alone how that may differ for children with special needs. There needs to be more education provided to help professionals first recognize abuse, and second, how to detect if the signs are a result of abuse or due to a symptom of the child's disability. An example of active detection of abuse would be looking out for bilateral bruising, injuries in less common places, and/or abnormal behavior. The important thing to remember is that each child is different, and the normal behavior of one child may be abnormal behavior for another. Children with special needs can have additional difficulties in the disclosure process, which brings me to my next solution, to have careful support of disclosures of abuse. In an article written by Jones and colleagues, they found it is especially important that children with disabilities are able to have supportive relationships to assist in the disclosure process. Some children with special needs may be nonverbal. Thus, it can make the disclosure process more difficult for the child and the individual they are disclosing to. It is imperative that the individual being disclosed to does not act as a detective and maintains a neutral position in the situation. Once the child does make a disclosure, or you have reasonable suspicion to believe that the child is being abused, you must make the hotline call. This is extremely important because nothing is going to be done about the abuse if no one knows it's going on in the first place. The last solution goes hand in hand with the second one. It is of the utmost importance that these children have trusted adults in their lives. Ideally, the trusted adult for these kiddos would be their caregivers, but oftentimes their caregivers are the ones who are inflicting the abuse. Teachers, psychologists, therapists, doctors, and any other professionals who see these children on a regular basis often have the opportunity to build trusting relationships. In order to build a relationship with children with special needs, it is going to take time. Learning what works for each child will help, as well as using positive reinforcement and help-seeking behaviors. I have taught some lessons for almost 7 years, and I have taught several children with special needs. And once you build a trusted relationship with these kids, it is rewarding for both people involved. So, what can you do if you are not a professional working with children with special needs in order to be an advocate for these children undergoing abuse and/or neglect? First, you can use what you have learned in this class to watch out for signs of abuse. Second, you can help to educate others about why it is important to know the signs of abuse and to also use active detection of these signs. Lastly, you can help end the stigma surrounding children with special needs and understand that they, as much as everyone else, are valued individuals who deserve the same treatment as their non-disabled peers. Everyone can help to play a role in preventing child abuse in children with special needs. By following the 3 solutions I discussed today, you and other future professionals will be better equipped to tackle this problem. All children deserve to be loved and cared for without undergoing abuse and/or neglect. I hope this presentation helped you first understand what the problem is and why it is important. Secondly, I hope it gave you 3 ways to be an advocate for children with special needs undergoing abuse.